Hey there, I'm Dr. E from Impact Physical Therapy, and I'm excited to give you some great information on how to fix your shoulder pain at home. This is the first of the series. We're going to be talking about pain on your shoulder, anywhere on the front side here at all, like here or here or here, front of the shoulder pain. I'm going to give you some really good, helpful tips and ideas and ways to improve the symptoms that you're having here. So a couple tests that you might do, or I'm going to have you try out home if you're having any kind of front of the shoulder pain. You're going to try a few of these. So the first thing you're going to do is you're going to bring your arms all the way straight up overhead, just like that. And if you start to get some pain either through here or up at the top, kind of in the front of the shoulder, we'll talk about what that could be. Could possibly be some impingement, some other things, but we'll give you some exercises for that. The next test, so you're going to try that one, is you're going to bring your thumb down just like that, and then you're going to bring your arm all the way overhead. And if it starts to hurt and get a little bit more uncomfortable on the front of your shoulder, that could be a positive sign for what we call impingement. It just means those structures are getting pinched down. There's not enough room, and the inflammation in that area is kind of creating a pinching. Another test you're going to do is bring it to the side like this, and then you're going to lift up just like that. And if you start to feel, man, that does kind of bother me, those are, again, another sign of what we call impingement, so front of the shoulder pain. Now, that just tells us where the location of symptoms are, but that doesn't really tell us how to fix it or what to do or what kinds of stretches and what things to avoid. So I want you to if you have pain or have a friend or family member with any kind of front of the shoulder pain, tag them on this video or send it to them, because we're going to give them some really helpful strategies and exercises coming up after this video. All right, so we quickly talked about pain in the front of the shoulder. So one key important item that I want you to make sure that you're doing is if you notice yourself kind of leaning over with bad posture, we really want to get that shoulder back to open up all those structures, okay? So notice yourself in the mirror if you're kind of hunched over and you've been doing a lot of computer work. Our goal is to get you opened up. So you're going to use a foam roller. There'll be a couple exercises with this, so I'd suggest getting one or borrowing one or ordering on Amazon because they're still delivering. But again, we're going to open up the front of the shoulder. A lot of times the pec can get really shortened and tight and pulls us forward. So we really want to open that pec up. So you're going to use your roller. If you don't have a foam roller, that's okay. Maybe try something else like a broomstick. Elbows straight, and then you're going to rotate and turn to the side. So if my right shoulder is hurting, I'm just going to rotate and open up, and I should feel a nice stretch and pull in my arm through there, okay? You're not cranking on it, you're not going fast, you're not going to go up here because that might bother you too as well, but you're going to rotate and kind of open up to that side. All right, so what I want you to do is you're going to do 3 sets of 10. So you're going to do 10 times, open up that shoulder. My guess is if your shoulder pain's on this side because you're rolled forward, you might as well do it to the other side. So do 10 the other way, and then come back and do another 10. So 3 sets of 10, should be comfortable. You shouldn't be pushing it too hard. Sometimes using a little heat before you do this exercise can really help. So heat for 10 minutes, get it all warmed up, and then try doing a little rotation to open up that shoulder. All right, another exercise that'll really help with the front of the shoulder pain is opening up your chest. So again, use the foam roller. One of the videos I showed you, we did a little bit of opening this way to open up. This time we're gonna lay on it and work our thoracic spine. That's the upper back, pulls the shoulder blades back, opens up some space in the front. So you're gonna lay on your back. You're gonna have the foam roller about mid-level here, okay? Your hands are gonna be behind your head. I want you to interlock your fingers, bring them on the back of your head just to make it more comfortable. Key on this one is really when you bend backwards, is that you're opening up your shoulder and you should feel a pull. Now, if it hurts, you can modify the position your shoulder's in, but remember, we're trying to avoid this sort of crunched up forward position. So you're here, you're laying all the way back, breathing, holding for a couple seconds, and then come back up. Okay, you're gonna do 10 at each level. So I'm gonna do 10 at this point of my back, pausing at the end, coming back up. Then I'm gonna move the foam roller up my spine. I'm gonna move it up maybe an inch or two, then I'm gonna go backwards and come back up. Okay, so think about going maybe 3 or 4 spots on your spine from your mid-back all the way up, doing 10 at each point. Again, opening up your shoulder. I want you to work on those before you do your strengthening exercises, which I'll show you in the next video. All right, so the next thing we wanna do is if you have some weight, that's awesome, a dumbbell. If you don't freak out. You can use like a canned soup or anything with a little bit of weight on it that you can hold. We want to strengthen the back of your shoulder, those muscles in your shoulder blade. It'll help to pull your shoulder back and build those endurance type muscles so your posture looks a little bit better. Okay, so you're gonna grab a weight. I'm gonna use 10 pounds. It's called a bent over row. So you're gonna bend over and you're gonna pull this weight from, like you're pulling from your elbow straight back, and you're gonna try to pinch that shoulder blade back. So one important thing, couple important things with this one, is I'm gonna pinch back, but notice that I'm not doing this where my shoulder is going way far forward. That'll actually hurt it more. So I'm not doing this, right? And I'm not doing this where I'm lifting with my trap. I'm pulling down and back. I'm pulling down and back, just like that. Okay, I'm bending over, pulling down and back. Pause at the top, pulling my shoulder blade back. Okay, you're not gonna crank it way back because again, it might bother you. So just nice and easy, pull back. This one, same thing, 3 sets of 10 with a comfortable weight that once you get to 10 or so reps, it should start to feel fairly hard. All right, so one more strengthening exercise for your shoulder, again with pain on the front side. We're gonna strengthen your rotator cuff a little bit. So you're gonna get a towel roll, you're gonna put it underneath your arm like so. You're gonna get a really, really light weight, 3 to 5 pounds or less even. And if you don't have that, no big deal, even just like a canned soup. So you're gonna hold on to that weight. This is my painful shoulder. I'm gonna lay on my side. I can lay on the ground, I can lay on a bed or a yoga mat, okay? This other arm, if it doesn't hurt me, I'm just gonna be up like this in kind of like a side plank, okay? My knees like that. Couple key points to this exercise. If you have a tendency to go do this, set your shoulder blade back. So notice I'm trying to keep really good posture and pulling my shoulder blade back. Bring my elbow to 90 degrees, so I'm here like so. I'm gonna bring my arm up here and then I'm gonna bring it down slow. So I'm bringing it up to about 90 degrees. I'm not bringing it all the way back here like that, just up to about 90 degrees, a little bit greater, and then down nice and slow. Okay, so I'm bringing it up here, down nice and slow. 3 sets to 12 to 15 repetitions.